increase of 9% from the previous week, but the number of new admissions is falling. And it's a better picture in Scotland, where the number of hospital cases fell by 13% compared to the previous week. Northern Ireland is yet to publish figures for the last week. Well, we're joined by our health correspondent, Dominic Hughes. So what can we read into these figures? A record high level, but the rate of infection seems to be diminishing.
Yeah, so there are a couple of things going on at the same time here. So that rise in flu cases that we've seen, very dramatic over the last couple of weeks, has definitely slowed. As you were saying in the introduction, 18% up on last week, but compare that to the week before when it was up by 55%. So that is a dramatic slowing of the increase. But still, we are, as you were saying, at a record high for the number of people who are in hospital with flu, certainly in England. Now, we've been hearing this morning from Professor Julian Redhead. He's the National Clinical Director for Integrated Urgent and Emergency Care at NHS England, and he said the NHS is not out of the woods just yet.
Flu hits different parts of the country at different times. There is some evidence that maybe in one or two regions that we might be hitting a peak, but we don't know how long that peak will last, and we don't know whether it'll be sustained, because it does depend on the transmission into the older, more vulnerable patients, and it also depends on the social mixing, which we know will occur over Christmas. But that's why it's so important for everyone to get the vaccine, so that we can protect our most vulnerable patients and protect them from serious illness.
So as you were saying in the introduction, a very sort of similar picture in Wales. Admissions to hospitals in Scotland have actually fallen, which is really encouraging. So I think it's unlikely we're going to see the kind of slightly apocalyptic picture that was being forecast last week, the week before, where perhaps maybe 5,000 to 8,000 people were in hospital in England alone with flu. But the NHS is still under an enormous amount of pressure. Norovirus, the winter vomiting bug, admissions to hospital in England for that bug were up by 20%. 94% of the beds in English hospitals are occupied. That's an incredibly high level. You add to those winter pressures the ongoing strike by resident doctors in England, and it's clear the NHS still faces some very challenging days ahead.
Indeed. Dominic, thank you. And you can use the tool on the BBC website to find out how many flu patients there are in hospitals near where you are. Well, as parts of the UK continue to battle that spread of flu, some schools are bringing back measures first introduced during the pandemic, like hand washing and mask wearing. Ahead of the Christmas break, our education correspondent Hazel Shearing has been to see how one school in Leeds is responding to its own outbreak of the virus.
It's always winter in Narnia, and it's beginning to feel a bit like that at this primary school in Leeds, where coughs, colds and the flu have been disrupting lessons this term, sweeping through both the children and the staff.
I was really sniffly and couldn't move for ages. It took me like 6 hours to start moving again.
I also had a fever, and it was like a fever and a headache combined, so it was like quite bad.
It was really annoying not being able to come to school because I didn't get to see my friends.
It kind of still feels like COVID because there's an area in school where there's like the hand sanitizer thing.
Hygiene drills that became so familiar